Acute throatache, losing one's voice, persistent cough, fever, earache, body ache, fatigue. These are some of the symptoms of what seems to be a strain of a viral infection that is affecting many adults and children. Doctors, in fact, have, according to some, seen a 2.5-time rise in patients with acute respiratory symptoms versus what it was a year ago. A Mumbai-based lung specialist says the rise has been especially stark since mid-Jan this year, treating an average of 25 patients a day in the OPD with such symptoms. Patients across age groups seem to be catching it. Elderly, those with comorbidities, and kids who are now getting more exposed to viruses post-COVID-19 seem to be more susceptible. It is difficult to point out a cause for the viral circulating or which viral it is. Some doctors have said it is influenza A or H3N2, while others say it is difficult to pinpoint what it might be. It could be due to a mutation of a strain of the flu, and one can't even rule out a strain of COVID-19, with a doctor pointing out many of the symptoms being similar to COVID-19.
Different types of viruses which are circulating, it's very difficult to pinpoint any one. Flu, when we call it, it's mainly indicating towards either common cold. That's the commonest term used by a layman, but in medical terms, flu means usually influenza.
The key difference between this respiratory infection versus others is that the symptoms are lasting longer, sometimes going into 3 to 4 weeks of a cough versus a general time frame of recovering within a week.
The symptoms are more respiratory rather than in the COVID. It was symptoms which was including the gastrointestinal symptoms as well, like loose motion. But in this particular flu, we have typically flu-like symptoms, which includes the body ache, myalgia, headache, cough, cold, fever, and usual flu-like symptoms. But this particular this particular virus, the cough is more pronounced, and it really remains longer than 15-20 days, and it also goes on for a month together.
We are usually seeing extended phase of cough. Usually patients with viral infections recover within 4 to 7 days, but now we are seeing patients with cough and throat symptoms persisting beyond 2 weeks, in some cases up to 3 weeks.
Doctors say the reason for the repeated virals is possibly due to seasonality, more exposure post-COVID-19 to a persistent cough, throat irritation due to pollution, especially in metros such as Mumbai and Delhi. What starts off as a viral infection turns into a post-viral bronchitis, which is caused by allergies to the air pollution that eventually aggravates it.
This is a seasonal flu virus, but this time it was more in terms of sheer numbers. That probably because of lack of immunity which we weaned off in last 2-3 years using the mask, and the sudden temperature changes that we happened here in the country. So this all has led into the severe flu infection, which almost it spread more than what we experienced during the COVID times.
So air pollution is definitely one of the risk factors which is driving the infections in Mumbai. So as the summer is coming, it will probably in another 4 to 6 weeks will be set into pretty much into a summer season. That's when the expectations of viral infection, which are predominant in winter and spring season, are expected to go down. So probably another 4 to 6 weeks it should take for Mumbai to breathe a little better.
Treatment is generally tailored to symptoms. It is a combination of common remedies such as anti-flu, cough medicines, antibiotics, and if it worsens, steroid inhalers are not ruled out either. Rest and simple remedies such as steam, gargles are all treatments that need to be followed till symptoms persist.
We do not advise antibiotics. We always tell patients to stay away from antibiotics until and unless their care provider is prescribing them. We usually resort to symptomatic management like cough syrups in adults, and other nasal decongestants, nasal decongestant drops, cough soothing lozenges, and in certain cases we offer them home remedies like steam inhalation and warm saline gargles.
Generally, these flu virals are a milder infection, but in the patients with the comorbidity like having a diabetes or an hypertension or an age, all those patients can lead into the lower respiratory infection with a viral pneumonia, with a secondary pneumonia. Also, that can increase the hyperbronchial response, and people can have cough, asthmatic attacks, cough which is prolonged for months together. that can be a residual body ache for the people, the same way what we see it in the long COVID as well.
Luckily, while the volume of patients have been high, say doctors, it is generally resolvable and very rarely life-threatening. Doctors have seen complications such as pneumonia due to the persistent coughs, mainly with elderly patients and those with comorbidities.